Every year, Americans are consuming vast quantities of food, but big appetites can come with big risks. One study found that common food pathogens cause nearly 10 million foodborne illnesses and more than 50,000 hospitalizations in America each year. Experts now fear that warning signs may be missed as the White House has moved to cut 20,000 employees from the Department of Health and Human Services, which includes staff at the Food and Drug Administration.
Without the epidemiologists, you can't ever put those cases together. And so if you get rid of the people that keep track of the statistics, then you don't have statistics anymore. You don't know whether things are getting better or worse.
It's reported that among the cuts initially made were freezes on government credit cards, which are used to buy food to perform routine testing for bacteria. The cuts also included suspending food safety programs focused on milk and vegetables, as well as a program designed to enhance testing for bird flu in cheese and pet food. Some of the cuts to agencies responsible for food safety have now been rescinded, while others haven't.
The entire division that handles restaurant food safety and toxic chemical exposures at the Centers for Disease Control and Prevention has been let go, and they have not been reinstated, even after Health Secretary RFK Jr. acknowledged that this was probably a mistake. So it's an approach of making cuts first and asking questions later, and it's really put our food safety system at risk.
The concerns of experts come as the United Nations marks World Food Safety Day on Saturday, June 7. This year's theme focuses on using scientific knowledge as a key tool to reduce illness. But scientists are worried that in the current environment, outbreaks may not be as easily identified and solved.
The sad thing is that we really do need the best and brightest to carry out this work. Solving and preventing outbreaks is difficult detective work. It's not easy, and it is beyond reckless to squander the talent that we have. We are really losing a generation of public health expertise with these firings, which could take decades to recover, even if the administration were to reverse and restore some of these positions as they have been doing.
Sarah Sorsha adds that experts have already noticed recall and outbreak notices not being posted publicly, meaning consumers might not know that some foods are unsafe. In statements to the press, the Food and Drug Administration and the Department of Agriculture said changes to operations won't change their commitment to food safety. And the FDA added it's continuing to conduct inspections, enforcement and oversight to keep people safe. It's something experts are now watching more closely as concerns grow over the safety of the food Americans are consuming. Mitch, McCann, CGTN, New York.